On the Medical Watch, a coil to clear the nasal passages.
Medical reporter Dina Baer has more on an option for sinus treatment.
Struggling to breathe is a common plague for many people in this country, and the options for repair are pretty dismal. Painful surgeries that often don't work. Now, a simple option giving patients a chance for relief.
Congestion in the environment can lead to congestion in the nose.
Hello.
Perhaps it's a furry friend forcing you to sneeze.
Allergy medications can be tried, and when appropriate, antibiotics.
Nasal sprays and steroids are an option, but
When those have failed, then that's when we start thinking about whether a procedure would be something that they are a candidate for.
pictures inside the head taken in a CT scan give doctors a clear view of what it will take to clear the sinuses. The images of Carol Temkin, a lifelong allergy sufferer, were bleak.
And so what we should see in the spaces of the sinuses, here, 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 and here, these areas should be entirely black, telling us that they're filled with air. When we see that there's gray inside, it's an indication to us that there's unhealthy sinus functioning or sinus congestion. That we're actually going in to find the natural opening of the sinus and make that opening larger.
For that, otolaryngologist Dr. Ryan Vaughn turns to technology used for decades to open clogged arteries to the heart.
Many patients become a candidate for what's called balloon sinus dilation, where we'll use a balloon, just like a heart artery can have an angioplasty. We'll use that same balloon inside the sinus opening, and that will simply push the tissue out of the way. Once it does that, we can actually reestablish normal drainage, and with something like a dissolvable stent such as Propel, it will actually prevent the sinus from shutting down.
Sinus issues shut down Carol Temkin's chances of seeing her family.
I literally just cried because my family is the most important thing to me. So not being able to go visit them in Colorado and Texas, you know, I thought, what am I going to do?
If she flew, doctors gave her a prognosis she couldn't bear to hear.
The chances were great of losing my hearing. I thought, I have to do this. I have to try and have quality, better quality to my life.
With her family in mind, Carol decided to undergo the sinus stent procedure.
So she actually had 4 stents placed, and so those 4 stents were placed strategically inside of each of the sinuses that had inflammation to keep them open through the recovery process.
I feel much less pressure. I don't have the sinus headaches that I had been having prior to surgery, so that part of it is better. And I actually just flew last week to visit my kids in Texas, and I did very well.
90% of patients, when they're treated with an endoscopic sinus intervention, are going to be treated for the rest of their life effectively, not requiring a revision sinus procedure.
Oh, I'm so happy that I made the decision that I made.
In most cases, the procedure is covered by insurance. There are some risks since the sinuses are so close to the eyes and brain. That's why doctors use an image-guided technique to ensure accuracy. Back to you.